Perhaps the summer heat will keep more of us inside this weekend, and that could also help stop the spread of COVID-19, which continues to surge here in Texas. A look at some of the major milestones we hit this week. On Tuesday, the United States hit 3 million cases, mostly fueled by surges in Florida, Arizona, and Texas. The death rate has remained low. The country is not reporting 2,000 deaths a day like we were in April, but the death toll is rising quickly here in Texas and several other states. This week, we set another grim record with more than 10,000 new cases in Texas in a single day. Doctors and nurses are treating more than 10,000 patients, a new record for hospitalizations. As numbers for COVID-19 continue to surge here in Texas, there may be a new way to fight the virus, and it looks a lot like your home air filter. Now, the University of Houston worked under the founder of Metastar to come up with this. Manzir Hirani and the UH team figured out what heating a nickel foam filter could actually kill the coronavirus. UTMB's lab, they found it killed 99.8% of the virus on the first pass.
This can be truly an affordable, low-cost, accessible opportunity for us to help contain COVID-19 indoors.
So now they're hoping to form a public-private partnership to mass produce the filters and make them affordable for all of us. This week, doctors across the state received an email from the Texas Medical Board. It asked them to reach out to retired or out-of-state doctors to see if they can help Texas in its fight against COVID-19. As our Lauren Zakalik reports, that speaks volumes about the current state of affairs here at home.
The email was titled Call for Retirees and Out-of-State Providers, and in it, the Texas Medical Board reminded their members that retirees and out-of-state doctors can currently fast-track the process to come work in Texas. The board then asked members to spread the word.
What we're finding is that bed capacity is not as much of an issue as staffing capacity is.
But for some, that email was more than just a reminder.
What did you think when you got that email?
I think the impression I have is it is telling of the situation and the status that we're in.
It was a commentary on our current COVID crisis.
This is really, truly a disaster situation. It's an emergency situation.
Dr. Mark Casanova is president of the Dallas County Medical Society and on the Texas Medical Association's COVID task force.
There's a reason it went out right now, and that reason is what we're seeing unfolding in our hospitals.
Dr. John Carlo is also on that task force.
Our healthcare system has been at this full speed since March. So anything we can do to relieve our frontline healthcare workers, even for a shift, I think it's important to do.
If you don't have a healthcare crisis in your community, please come help us in New York now.
Both doctors said the email felt a bit like this moment from March. The Texas Medical Board president says thousands of out-of-state health care providers have already begun helping since March, mainly in telehealth, but they still need more.
We're trying to stay ahead of the curve with this.
I'm Lauren Zakalik reporting.